out, similar to what Terry Aiken. So I don't know why he can't get that from them, so I think I'm not prepared to answer that question.
All right, just a follow-up question with that. The treasurer has said that this plan would drive up testing. How do you respond to that?
Well, I appreciate Mr. Aiken's statements. I think that we've heard him say, and I was told this morning that he said that I said that. I think it's offensive to suggest that we would do inappropriate things, that any of our providers would do inappropriate things for, and so we've heard conflicting in this testimony, frankly, we've heard that the word fraud, waste, and abuse, and then we heard a little bit ago that this wasn't about fraud and abuse. And so there's a suggestion that we have some conspiracy out there that we would do something nefarious and wrong. And I think that that's an affront to our professionals and the people that wake up in the middle of the night and in the middle of the day to take care of North Carolinians. So I don't know where that came from. If it's suggested, which I was told this morning that I had said that, I would like to hear the tape or to have a witness, because I've never had a conversation with the treasurer without a person in the room. So I don't know where those kind of myths come from. I personally am not chasing myths. I want us to have solutions to complex problems. That's what we've heard. Liabilities that have been increasing over 40 years need time and thoughtfulness and collaboration to solve the problem.
Thank you, Dr. Falwell. Chairman Bishop.
Thank you, Mr. Chairman.
Sorry, Dr. Walden. I don't know if that was a big promotion or what.
I'm not at 100% today, Mr. Chairman, by any means, but...
But you on less than 100% is better than all of us.
Thank you, Mr. Chairman. I just feel compelled to say, particularly as I've heard the comments roll out, that what has been unusual about observing this for the past several months, and in fact listening to the comments in this room, is how extraordinary it is for a public official with sufficient stature to do so to step forward and demonstrate will to change the status quo. And the response that I have seen is highly personalized. Maybe that's gone, the rhetoric's gone both ways, I don't know. But it's interesting. I listened to the information about transparency, and I'm interested in the treasurer's response to what we just heard from the other end of the table about why he can't get it or doesn't have the information he needs from the state health plan. But certainly the people's experience out there, I think is exactly right. It's a murky swamp. You can never figure out what something costs. And bills are a surprise. The system completely eliminates consumers from the decision-making process. And although this issue has been ongoing in the country forever, I understand that the response of the hospitals is to say, we need to collaborate. And yet, the fact that information is not fully transparent, as I understand, is justified because you're functioning in a market system vis-a-vis insurers where you're adversaries. Markets are adversarial. And I think it's telling that the system has so long been so immune from competitive pressures of competition that you're offended by the notion of an adversarial relationship. It is fundamentally adversarial when you're talking about who the buyer is and who the seller is. And I think those things are going to have to be dealt with in order to squeeze inefficiencies out of the system. So I see a real David and Goliath issue here. And I'd like the treasurer's perspective on a little more detail about why he doesn't believe that the state health plan has access to adequate information about cost in order to determine what you should be paying as you phrase your claim.
Mr. Treasurer.
Thank you. I'll be glad to answer your question regarding Mr. Aiken. Cone Health is one of the role models of how to do things correctly. We sent a team over to meet at Cone Health about reference-based pricing, and Mr. Aiken wasn't there. So another example of why we're going around meeting with folks, but they're not present at the meetings. And to answer your question, when we go to Blue Cross, they say that by contract with these providers, they cannot share this data with us. When we go to these providers and say, if you'll release them from that, won't you share the data with us about what we're supposed to pay? So we sent Mr. Waldron a letter at Biden Health probably 5 or 6, or maybe 7 or 8 weeks ago, and we were trying to figure out really what's happening in Eastern North Carolina about healthcare costs. And I asked Mr. Waldron if he would agree for the state health plan to release information about how healthcare costs have gone up on people in Eastern North Carolina over the last 5 years. And the letter's right here. It says we do not consent to that. Nobody wants us to know what we're paying. And as far as the earlier comment that was brought up about driving up utilization, that was made by the executive director of the Hospital Association, not in a private conversation, but the press was there and about 14 other people. So if Mr. Waldron feels like that was directed toward him, it wasn't. It was directed toward the executive director of the organization he represents, Mr. Waldron.
All right, Senator Crawford, you're recognized.
Thank you, Mr. Chairman. My colleagues have pretty well covered everything, but I want to thank both of the gentlemen for their presentations today. Particularly, I want to thank you, Treasurer Falwell, for bringing this to our attention and having everybody focus on it. We have all heard the stories from our constituents about not being able to get a price, particularly those who are paying for their own care. Well, he was a doctor. Not in my district, but in a close district to me, was shopping around because he was paying it himself. He had a quote of $28,000 to perform a surgery for his daughter. And he shopped around, went to a satellite of that hospital and got it done for $6,800 because he was paying for it himself. He shopped around and he found the best deal. Most of us have no clue what we're paying and we don't care because we're not paying it. But transparency is a must. I agree completely with the treasurer. If we don't have transparency, we are never going to be able to get the cost in a downward curve on health care. And Dr. Waldron said something I thought was interesting. He said a 30-year liability can't be fixed overnight, and that is absolutely 100% true. We know that. But had we dealt with it 30 years ago, we wouldn't be here today. So we've got to start somewhere. And this is the place to start. This is the time to start. And I applaud the treasurer for what he's doing. I applaud the hospitals for the service that they provide to our people. We have to get together and we have to figure out how to do it. But it must be done. And this is a good place to start. So thank you all for being here.
Thank you, Senator Crawford. Representative Potts, you're recognized.
Thank you. I have two quick application questions for the treasurer. I believe your quote was if they are not providers, it's because they choose not to sign. What happens to the application and the processing of state employees' health care claims if the provider chooses not to sign? And are they required to? Are you going to require to see a provider that is signed or pay additional premiums?
Thank you for your question. Thank you, Mr. Chairman. We hope that doesn't happen. You know, as I said earlier, we're optimistic that we have enough needs, providers, and billions of dollars. We all will be able to figure this out. But we all know one thing, whether it's in Davidson County or any other county in North Carolina, people like being able to take care of themselves. People like being able to pay their bills. That's innate. People like that. And the fact is that this issue that you may be referring to, called balanced billing, is already going on across the state. The leading cause of bankruptcy in North Carolina is bankruptcy associated with health care costs. This is already happening now.
Follow up, Mr. Chairman.
Follow up.
You said earlier in your comments that there's people in this building whose family are receiving Medicaid because they can't afford the family plan on the state health plan. Are you saying that your cut of $300 million will bridge that gap and that they will be able to now afford family plans under your proposal?
Absolutely. I wasn't given enough time to explain what we have done in the state health plan. First thing is, all of you know who have one of these pockets, this card in your pocket. We have told people, maybe for the first time in state history, this is their plan paid for by them and taxpayers like them. For nearly 30 years, people thought that the state health plan was insured by Blue Cross Blue Shield, so every time they took that card out of their pocket, they thought they were sticking it to Blue Cross. Now, for the first time in state history, when they pull that health plan card out of their pocket, they're thinking about it as deeply as I know some of you do. Any credit card or any cash that you pull out of your pocket, number one. Number two, as I said earlier, we're just attempting to push the power away from us and give it to the consumer. And I'm a little embarrassed to say this, but Ms. Chairman, would you ask the other chair to ask his question again? Sometimes we just forget things.
No, sir. Representative Potts, would you rephrase the
The
question?
second question. Just ask it again.
Ask it again, bring it.
Thank you. I said, you said previously in your comments that there's people in this building who children want. I ask you, with your proposal to cut $300 million from under your proposal, give them the ability then to afford family health plan?
Absolutely. We, in the first 2 years of our administration, we have frozen family premiums without changing benefits and without dipping into reserves. But we need to make a meaningful change in the family premium, and that's exactly what we intend to do. The way we were able to freeze all premiums for this year, all premiums, because of a fantastic negotiation on our Medicare Advantage contract. This is for employee retirees over the age of 65. This was something that was directed by PED out of this very building probably about 8 or 9 years ago. We have now 90% of state employees who are on the United Healthcare Medicare Advantage contract. We took the savings from that contract and we used it to freeze all the premiums for everyone else in the plan. And that's the message and that's the culture that we're creating at the Treasurer's Office. When we save money in any part of the spectrum, the active employee, the retired employee who's not yet 65, and the people over the age of 65, when we save money, we're sharing those savings with the people in the plan. And that is what is so exciting about this. We have made huge progress
Thank you, Mr.
in that
Chairman.
respect, but we got more to do.
Actually, I do have a question.